When David Robbins was a senior in high school in 1990, he felt a lump above his clavicle and was shocked to learn that at 17 years old, he had Hodgkin's lymphoma, a type of blood cancer.
I had 6 months of pretty rigorous chemotherapy. And then I had 1 month of radiation therapy as a freshman in college.
He beat the cancer, doctors warning him to watch his thyroid, but that was it.
It was almost like, okay, don't let the door hit you on the way out, have a good life. And that's kind of how I was living.
His experience with lymphoma led him to become a doctor himself. Decades later, a conversation with a cardiology colleague who knew his cancer history told him he should probably get his heart checked.
I was like, what do you mean? I'm cycling. I'm in great shape. I feel fine. He's like, let's just do a cardiac CT and see what's what. I said, okay, fine, somewhat reluctantly.
What Robbins didn't know is that some cancer treatments, like chest radiation and chemotherapy, can increase the risk of heart disease years later. And tests showed Robbins was already living with it, despite being completely asymptomatic.
It turns out that I had a greater than 70% narrowing in what people call the widowmaker. Here I am, 35 years later, and it's like my old treatment is haunting me.
This is considered a high-risk form of coronary artery disease.
Patients who were treated with treatments like mantle field radiation involving the heart in the thorax face an increased risk for cardiovascular disease decades later that we've really only been able to appreciate because patients are living longer than ever before.
Robbins had minimally invasive bypass surgery, and he's doing great, but wants to warn others of heart risks that may surface decades after cancer treatment.
If you had radiation really at any point, but especially in your 20s, you need to talk to your doctor about it and know that your doctor may not even know about it.
There's an emerging field called cardio-oncology, devoted to the care of the heart in cancer survivors, the focus of which is to ensure that the cancer patient of today does not become the heart patient of tomorrow. If you're a cancer survivor, especially one who had radiation to your chest or chemotherapy, this is a conversation to have with your doctor before symptoms ever start. Early detection here, guys, is really key.
As always, boy, I never would have thought of that connection.
Yeah. Cardio-oncology, a very important field.
Thanks for bringing it to us.